Okay, Commissioner Tega, you're ready to go. Thank you.
All right, thank you. I'd like to call to order this special meeting of the Ramsey County Board of Commissioners. It is being recorded and live streamed. There will be no votes taken today. Today is Friday, October 24th at 10 o'clock. My name is Rafael Ortega, Ramsey County Commissioner for District 5. Why don't we go around the room with the commissioners and staff, and then Ling, why don't you just take it over right after that?
Thank you, Mr. Chair.
Do you want us to just start introducing ourselves, Mr. Chair? Mary Jo McGuire,
Yes,
Commissioner,
just
District 2.
Introduce yourself.
Yeah, Mary Jo McGuire, Commissioner, District 2.
Garrison McMurtry, Commissioner, District 3.
Kelly Miller, Commissioner, District 7.
Rena Moran, Commissioner, District 4.
Oh, Mai Chan-Shang, Ramsey County Commissioner, District 6.
Tara Jevon Singh, Ramsey County Commissioner, District 1.
All right, Ling Becker, County Manager.
Marissa Rabia, Chief of Staff.
Andrew Greenlee, Deputy Chief of Staff.
Jason Yang, Chief Clerk.
Liz Brady, Ramsey County Attorney's Office, Civil Division.
Alex Kutza, Chief Financial Officer.
Patience
Francois, Deputy County Manager for the Information and Public Records Service Team.
Patience Ferguson, Chief HR Officer.
Kristen Schultz, HR Manager.
Joanna Berg, Deputy County Manager.
Nadir Abdi, Deputy County Manager, Health and Wellness Service Team.
Ready? I think so. All right, first of all, I want to just thank the board for their time this morning. I know, this is a little bit unexpected to have to get together, but, the people that have introduced themselves as staff have been working really diligently over the past, few days and into probably a couple weeks here, trying to just, help manage some of the impacts of the federal shutdown. And as we near some dates, there are some things happening both in community and impacting our organization that we feel are important for the board to understand as context. So if we can go to the next slide, our goals today is to provide a high-level update of the to the board about the federal shutdown impacts, particularly as they surround the WIC program, Women, Infant, and Children, and the SNAP program, the Supplemental Nutrition Aid Program, that we receive federal funds to administer. We are hoping to get some general direction on next steps as we approach November 1st and the subsequent dates beyond November 1st should the shutdown continue, as to some of the decisions that we will be faced with as an organization. So if we can go to the next slide here, just a really quick agenda slide. We're gonna popcorn between some of the staff because there have been different people who are in really critical different spaces where we are getting updates, and we want those subject matter experts to share some of the information they know. In addition, we have Deputy County Manager Berg, our CHRO, our HR Manager Kristen here, who are part of what's called the Personal Impact Team, and they've been really helping us as we've been working on the 26-27 budget around how staff get impacted by decisions. So we brought them in as sort of a functional experts to help us with some of the contingency planning as well. So today we're gonna be sharing a little bit about the background, a little bit about the response that we've already been made, which you have been getting updates at county board meetings, and we've been sharing with the public as well, but we want to restate some of those. We're going to talk a little bit about the contingency planning and some of the considerations that we are taking as we go forward. So, and then we'll have a chance to discuss. All right. I think, yeah, this Karen.
Yes. Good morning, Mr. Chair, Commissioners, County Manager Becker, and colleagues. I'll just take a moment to provide a brief overview of the Supplemental Nutrition Assistance Program, or SNAP. SNAP is a federal nutrition assistance program that helps low-income households buy the food they need for stability and health. Recipients receive benefits on an electronic benefit transfer card or EBT card, which functions like a debit card and can be used for approved food purchases at participating stores and markets. To qualify, households must meet certain income limits, and able-bodied adults without dependents are required to meet specific work requirements. Under the 2025 Federal Reconciliation Bill, those work requirements are being made stricter, and states, including Minnesota, will begin implementing those changes on November 1st, 2025. In terms of scale and impact, about 440,000 Minnesotans currently receive SNAP benefits. Here in Ramsey County, we have more than 34,000 active SNAP cases that serve an estimated 85,000 individuals. And lastly, these benefits don't just feed families. They also support local grocery stores, farmers markets, and small businesses that accept EBT payments. SNAP remains one of the most important safety net programs we administer, especially during times of economic uncertainty. And now I'll turn it over to my colleague, DCM Abdi, to talk about the WIC program.
Thank you, Karen. Chair Ortega, Board of Commissioners, County Manager Becker, and colleagues. I'll briefly also state the summary of the WIC program and discuss the benefits and eligibility and impacts it has in this federal shutdown. So WIC is a federal funded administered program for nutrition, and it does provide nutrition and education for families so that their growth and well-being is there, and it's usually for pregnant women, new mothers, infants, and young children. The benefit of WIC is very similar to the benefit of SNAP, where you have the e-WIC card, and that's where the food you're able to purchase food with the card. The program provides nutrition counseling, breastfeeding support, and referral for healthcare and social services. It's almost like the beginning stages of where you're able to receive other services. So when you have the counseling part of this, where a counselor is having these conversations regarding food insecurity, it goes into also other social service areas that a person may need, and further discussion takes place. So it's very important. And from an eligibility standpoint, this program is for pregnant women, postpartum and breastfeeding infants and children at the age of 5. And the eligibility is also part of the requirement. It's federally funded program, so it's very similar to other programs that we have, where you have to meet income guidelines and making sure that that we determine the eligibility of the participant, and that is done by a healthcare professional. From an impact standpoint, what I would say is that there is over 100,000 Minnesota residents currently receiving WIC. And Ramsey County, that's over almost 18,000 folks that are receiving these funds and benefits. So this is a critical benefit for the most needed families. So we are trying to figure out next steps for the WIC program. And it's, in the further slide, we'll talk a little bit more about like the contingency plans that we have, and figuring out like the next 30 days how we're going to move forward with the federal shutdown. I will turn it back over. I don't know if Andrew, this is your slide.
Yeah. We did a little diagram here just to explain how some of the programming and funding works. So USDA at the federal level administers both the SNAP and WIC programs. At the state level, SNAP is administered by the Department of Children, Youth, and Families, and WIC is administered by the Department of Health. So USDA, those state agencies draw funding for both benefits and administrative costs from the USDA. And then when it comes to how Ramsey County is funded to administer that at the local level, the state provides SNAP administrative funding to Ramsey County via quarterly payments from this random moments system. So we receive quarterly random moments revenue from the Department of Children, Youth and Families, and that's how we pay for a share of our administrative costs associated with SNAP. On the WIC side, there we submit quarterly reimbursement request, I mean, not quarterly, monthly reimbursement requests to the Department of Health. So Ramsey County Public Health administers that program at the local level. They incur administrative costs for staffing and other things, and then they submit monthly reimbursement requests to the Department of Health. The benefit funding, so that's a little bit about the administrative funding. The benefit funding works a little bit differently. That doesn't actually hit the county budget. The state manages that funding, and they have a EBT contractor, and they work with the same EBT contractor for both programs. So the EBT contractor issues benefits to residents' EBT cards, and then residents, use those benefits at local food retailers. And then the EBT contractor reimburses the retailers for the food purchases made through the EBT card. So that's how the benefit funding kind of flows through. And then what does Ramsey County do? Well, advance the slide one more. At a very, very high level, financial assistance services assist residents with applications and verify eligibility. And then on the public health side for the WIC program, public health staff verify eligibility for WIC, and as DCM Abdi was saying, provide nutrition education, breastfeeding support, and referrals to other support programs.
Thanks, Andrew. So if we go to the next slide, you'll see just some more granular WIC updates. And I want to preface this by saying, board chair and county board members and leaders here, Ramsey County has been at the table. And so we're thankful that we've been at the table with MDH through by way of our public health leadership. And MDH in September requested that they have ability to adjust the WIC agreements, and they added a suspension clause. And I think that was a safeguard. My thinking is that's a safeguard for the agency itself because of these uncertain times. And then in October, and we agreed to that change in our agreements. And then in October, MDH WIC initially stated that their funding was available by way of USDA to sustain program for a few weeks. And then later we heard from MDH, our WIC area, that they're reporting some additional funding from USDA had been made available to cover WIC costs through mid-November. So the important note about this is it changes. We may hear something different today, next week, but for now, our understanding is that we have enough funding through the structure that Andrew related through mid-November. If we go to the next slide, this is more so about our SNAP updates, and this is a space where actually we've been very connected with DCYF from this exec team all the way to program leadership, and they've been very open and engaging with us, and we're thankful for that. But they too are in a similar state in terms of USDA notifying DCYF that funding for SNAP is running out in November and that benefits would not be issued. DCYF also sent messages to counties and tribal partners about their planning to comply with the USDA guidance to prevent November benefits from being issued. At which point, we know that DCYF is working to prevent those November benefits from going through, and no new applications or certifications can be approved. There's a mechanics piece where we may be able to process or we may not, but we know that no benefits will be approved beyond November with the current status of the shutdown. And this would impact MFIP food benefits specifically, which are also USDA funded. So while DCYF initially stated that MFIP cash benefits may have to be blocked, they've worked really hard and they've implemented a solution at the state level so that we can preserve those food benefits on the MFIP side. And so that was a system solution that the state came up with after some partnership discussion and further analysis with counties. And important to note here is that the situation also continues to evolve and can change, but we're monitoring and we're in close communication with DCYF on this front. And they've been issuing daily updates to our program leadership as well. And so that's been a great piece. The next slide I'll go into.
Maria.
Yes, I'll pause there.
Mr. Chair, may I ask a question before we
Yes,
move on?
yes, go ahead.
I just wanted to go back to that slide of the graph. So what we are hearing from the state is that they have enough benefit, the money that they pass on for both benefits and administrative costs, right, will only go on until November 1st.
November 1st, there was somewhere where we said
November
mid-November
1st for SNAP,
Okay.
and November 7th, was it the 17th?
15th.
For WIC.
Okay.
15th for WIC, 1st for SNAP.
Okay, and that's both the benefit side and the administrative costs.
To date, that's what we are understanding of, yes.
Okay, thank you.
Sure.
Chair, may I have a follow-up question?
Yes, go ahead.
Okay, so I just want to make sure that I'm following this right, that while Ramsey County does provide services that help individuals access WIC and SNAP, we are not the direct funders of those beneficiaries. So the funding comes from the federal government, passes through to the state, and then that and then goes directly to the individuals themselves. Our role at the county is to help people access those services. And so
Correct.
any decision to fund or not fund happens at either the federal or the state level. Our role is just accessing what funds have been decided to be turned on or turned off.
Board Chair, Commissioners, that's correct.
That's very helpful. Thank you.
And Mr. Chair,
Go ahead, Mary Jo.
yeah, thanks, Mr. Chair. Thank you for all of this. I'm wondering, so are many people getting both? If you're eligible for WIC, you're probably eligible for SNAP. So people are getting both of these, and I'm trying to follow like the timing of all this. So are people going to lose both of them at the same time, or how many people are on both programs? And we got SNAP and WIC and yeah, different things. So are people either losing all or all of their benefits at the same time?
Board Chair, Commissioner, there are families that are on both programs. We haven't pulled the data to identify which families are benefiting from both buckets of programming or funding. So we can get back to you on that. Also, the timing is definitely in November thus far if the federal shutdown continues. It'll either be at the beginning of November or the middle of November.
And I just want to clarify something that my colleague, Commissioner Jevon Singh asked. So we provide the administration for both WIC and SNAP, but that doesn't mean we make the decision. Is that we don't make the decision on who's eligible? I understand the state actually gives, they release the money and the debit cards, but do we, okay, here, Ramsey County, I'm looking at this, verify eligibility. I see. Okay, I'm reading it now again. So that's what we do. We verify. Is that how we do the administration, is by providing eligibility, or how else do we do administering? Yes. That's what I'm curious about. Yeah.
Board Chair, Commissioner McGuire, you are correct. The federal regulations and then state statute, it's all beyond. We administer programs and we follow the eligibility rules that are set at the higher level of governance.
Yeah.
For this. So we do not have any authority on tweaking eligibility criteria. We follow the processes at the program level that are rolled out to us by the state.
I appreciate that. And of course, a number of us heard from our state legislators wondering why we were cutting all these, and we're like, well, it's your program, it's the state program that we're following. So it's a good education. Correct. It's a good education for all of us. So thank you.
Commissioner Miller.
I just have a quick question on the SNAP benefits. So thank you for clarifying our role in that. But also, so the benefits that have already been distributed and sent out to residents, if they have not used them, will they lose them, or will they still be eligible to use them after November 1st?
Board Chair, Commissioner Miller, we
heard this question earlier, we brought it back to our partners at the state, and our understanding at this moment is that they would remain eligible. However, USDA has the authority to pull that back at any time should circumstances change or that decision is made up the chain. Thank you.
Mr. Chair, may I ask another question?
Yeah, go ahead.
May you just briefly touch on why the cash benefits portion are able to continue to be distributed?
Board Chair, Commissioner, I might defer to Deputy Andrew here, but my understanding is the same funding source, but it is related to food, the plan, yeah.
Board Chair, Commissioner, yeah, originally, the cash benefit is funded through the TANF block grant. The only reason that initially there was a concern that they would both be impacted is because the state bundles those two benefits together in a way that was hard to disentangle, and they weren't sure that they were gonna be able to make changes to their IT systems in time to disentangle them. So essentially, the state was trying to to comply with USDA guidance, the state was trying to take every action to make sure we did not issue November benefits for SNAP and USDA funded benefits. Because that TANF funded cash benefit was bundled together with the USDA funded food benefits, they were originally thinking they would have to block both from going out to prevent the food benefit from going out. Later, they were able to disentangle them. So now, because the TANF funding that goes for the cash benefit is not impacted by this, they figured out a way, and I don't know the technical details, but to deliver that separately. And that did involve some kind of feverish work at the state level, and we're very happy that they were able to implement that solution. So now the cash benefit is what they're saying is that will continue to go out in November, but it won't be paired with the USDA funded MFIP food benefit.
Thank you.
Okay.
Okay, board, we're gonna go on to,
I believe Commissioner Miller raised her hand.
Go ahead, Kelly.
Thank you, Chair. I guess my question follows up to what I asked earlier, is if we don't know if those benefits that have already been dispersed will be lost, what is the advice to communicate to our community members? Do we advise them to use them? I mean, or do we, we would hate to see it instances where somebody has some saved and they're saving it for the holiday meal and then they're pulled back.
Board Chair, Commissioner, all communication has been to spend down your benefits as you would and ensure that you continue spending down until you have no more.
Let's go to slide 9.
So here I'm gonna talk about our response thus far, and I'd just like to take an opportunity to thank moreover our program folks, our directors that oversee the Medicaid area, our directors that oversee the WIC area, and our staff and leadership across the board. This has been a collective effort just to try to be prepared and be adaptive and understand and track a lot of nuance and rapidly changing information. So as such, we've stood up an internal group and we have daily huddles every morning to get updates and to be coordinated in our response. We have staff within the financial assistance service team who are working, have been required and have graciously worked overtime to process as many applications as we can amidst this timeline and approving as many benefits as they can within the month of October. There was some gas put on the pedal because we thought it would be a sooner date in October, but then we know we have through October to do as much as we can. Also, I'd like to lift up our communications and public relations folks. They have been posting information at the service center, online, on social media. We've been trying to be very communicative with our partners. We are trying to be very forthcoming and having foresight about the challenges that are going to impact our community. And we've been sharing that information with our delegation as well. We have a Fed response update monthly newsletter that's been issued. So government relations is also engaged in tracking all of this work. And we have partners at the county and state levels across the ecosystem. We know that our county manager Becker meets with the county administrators across the state. As I've said, myself and Andrew have been meeting with DCYF, MMB. We've even met with Hennepin County. Our FAS leadership has been in those spaces. Our public health director has been meeting with our WIC state folks as well. Our CFO has been meeting with finance leaders within this organization and across the state as well. And we are just in the space of contingency planning about the possible budget or organizational impacts that may be coming to us. So we're in a space of preparation. I will go on to the next slide, and I think there's more from Commissioner DCM Berg. Thank you.
Thank you, Maria. So as we look at our contingency planning, the speakers, oh, I apologize, Commissioner McMurtry.
Oh, I'm sorry, Garrison. I
No,
didn't
no.
see it.
Yep, no worries. Just a quick question
I gotta
on.
keep sliding back and forth to make sure I catch everybody on my screen. Go ahead,
All
Garrison.
good. Quick question on the previous slide on some of the response that we've already taken. Has there been any communication or collaboration with the food banks in food shelves in Ramsey County? Just they're going to be directly impacted as well with, I'm sure, an influx of residents coming and trying to get food and whatnot. So has there been any collaboration there?
Board Chair, Commissioner McMurtry, in the last 2 weeks, we've really set up these huddles and get our internal operations in space, but we know that we have a strong food insecurity network that's been established over the years as a result of the pandemic. And we're working to ensure that we keep those communications and supports in place, but that's another tier of effort that we need to shift to, I think, coming forward. And I'll pass it to County Manager to speak more.
Yeah, thank you, Commissioner. I think this is an important note that, Maria's right. We had to prioritize what we are core responsible to do, which is to ensure we understand how our operations work and the impact of how it affects that flow chart that you guys were, spending some time with. I got some very early forward emails from you all about community partners asking questions, and our encouragement to them is, you all have an ecosystem and have leadership and ability to, you already have, have a strong network, and go do that work. You don't need that necessarily. The county wants to be a good partner, but we don't have to lead that for you. You keep doing your good work that you as an ecosystem already do, if that makes sense. So I think there's been a lot of conversation happening in the community, trying to figure out their part of sort of the continuum, I guess, of operations. We're doing our part, there's groups doing ours, but you're right, Commissioner, that there needs to be in the next phase, if this continues, more linkages, if that makes sense. So I'm really grateful in Ramsey County that we have such a robust network. I will say in all our communications, we have shared out our food resources dashboard or our list, which we are very proud that it's available to the community, where we are a conduit to many of those networks. But those networks, our community, I think, is a really strong, resilient one that has an ability to mobilize with and without the county, I guess I will say. So, and so hopefully that's helpful. All right. So sorry, maybe Joanna, I know there's no other questions.
Nope, I'm good, thank you. So my colleagues have been articulate, commissioners, that we are dealing with a very fluid environment with a great deal of unknowns. We want to underscore that there is certainly a chance as the shutdown continues, funding for our SNAP and WIC staff will no longer be covered through state and federal reimbursement. We don't know at this moment if USDA is going to provide more contingency funds to extend either or both programs further into November. And so as we have been approaching contingency planning in this circumstance, we have been focusing on 30-day scenario planning windows and planning to meet with the board on a regular kind of monthly basis as the situation progresses. I'll turn it over to CFO Kutza for the next couple of slides.
Thank you. Thank you, Mr. Chair, Commissioners. You can go to the next slide. Thank you. As has been talked about earlier, there's an impact. So even though they close off the actual benefits that are paid to the recipients of SNAP and WIC, we still have staff that do the administrative work, and the staff is paid for through different mechanisms. So first we're going to look at WIC. WIC has 47.8 FTEs. The monthly staff cost is about $337,000, and the monthly cost for other administrative expenses like rent and office supplies and things like that is $18,500. Our revenue for WIC is through the WIC grant reimbursement, and it covers the majority of the WIC costs. We do have a small amount of levy, $575,000 per year in 2025, and $195,000 of that is remaining in 2025 and will be used before year end. We're looking at the spend out of that. So the risk for the county if the shutdown continues is about $355,000 per month once the tax levy and WIC grant funding runs out. If you go to the next slide. Oh, go ahead. Sorry.
I just have a quick question and just say based on, it's unprecedented, so we don't know if based on past shutdowns there's any application to this particular situation. But should the federal government reopen at some point, would we ever imagine that we would be reimbursed retroactively for any of these administrative costs?
Yes, thank you, Commissioner. That's a perfect question. I probably should have prefaced that. This is our risk. There is a good chance. There is a chance. I don't know if it's good or not. You are right. It is unprecedented. In prior shutdowns, I would have told you that we would be reimbursed and we were taking on a cash flow risk. I am unsure at this point, based on the current administration and lack of information, whether we will be. I think the risk is higher in SNAP than it is in WIC. WIC is a grant. They will likely be able to give us back the money, but it's unclear if they will do that. If we move to SNAP, I'm maybe say the answer for SNAP on that one quickly. SNAP receives the majority of their money through random moment time study, which means that employee has to ping that. So it pops up on their screen and they say, what are you doing right now? And you say, I'm working on SNAP processing. That feels riskier to me. And when I've talked to my colleagues at the state, they agree, because first, these risks are going to be in 2026. I want to be clear about that. We're about a quarter behind. So any money we would get for this quarter work of random moments would come in the first quarter of 2026. And the risk here is if we can't ping that, or even if we ping it and they say, well, you couldn't have been doing SNAP work, we were shut down, we may not ever see that revenue for the administrative costs of the program. I see Commissioner Moran has her hand up, so I don't want to keep going.
Go ahead, Brina.
Thank you, Chair Ortega. Just for clarity, I need to close up one of these apps. Give me one moment. So for clarity, what I think I'm hearing you say is that once the money is gone, are you asking the question, or has it been already decided that Ramsey County will pick up the costs to continue to fund SNAP and WIC? And this is the cost to the county.
Thank you, Mr. Chair and Commissioner Moran. It has not been decided. That is in your purview, not my purview. So that's why we're here today, to kind of share the risks. And we're getting, I think other speakers have said today, we are getting more information every single day. You know, a week ago, we didn't think WIC would be funded through mid-November. Now it is. If these continue to change. So today our goal is to share the risks and make sure you understand the financial impacts. My role is to make sure you understand the financial impacts of some of these risks. And then later in the presentation, we'll talk about next steps and where you might want to go.
Thank you.
So on the SNAP program.
Oh, wait a minute, do I have Kelly?
Sorry.
Commissioner Miller?
Yeah, I just wanted to clarify because I heard what Rena mentioned, but Ramsey County cannot fund the WIC program or the SNAP distribution benefits. We can
Right.
only fund the staffing.
Correct.
Okay, I just wanted to make sure,
Correct.
because, okay, thank
That's
you.
correct. Sorry about that. I should have clarified. I'm talking about the administrative costs right now, not the actual benefit to residents. Okay, so on the SNAP side, there are
Mr. Chair.
260.
Was that, hold on, I gotta, is that Rena?
Commissioner Zhang here.
Oh, Commissioner Sean, go ahead.
Sorry, CFO, because I'm probably getting ahead of ourselves here too. But for SNAP and for our staff during the shutdown or after starting November 1st, when we cannot process any applications or recertifications, what will staff just be left with doing nothing?
So that's probably not my question to answer, but I will say we can process applications. We can't approve applications. So they can absolutely do work on processing applications, and the state wants us to continue to do that. Others can speak to that as well. But we are also looking, and you'll see this in a couple slides coming up here, of pivoting staff to other programs that could be helpful, particularly in the healthcare programs. So no, staff would not be doing nothing. I think the risk comes on as staff continues to do their work for SNAP, like processing applications without approving them, will the federal government see that we are doing that work and pay us back? And that is unclear. It is a risk for the county, and it's kind of my job to make sure you understand the risk. So it's a risk to every every state in the United States and counties who administer these programs. So on the SNAP side, there are 263.5 FTEs. The monthly random moment staff cost is about $1.7 million. The monthly non-random moment cost for staff and administrative expenses, $592. The reason I put the random moment and non-random moment is because you would say, I thought you might say, wow, that's really high administrative costs. Well, much of the staff, like supervisory staff, like Director Ali, Deputy Director Hadeen, folks like that, they are not in the random moment cost pool. They are in the indirect cost pool. And that's what we're talking about here. So you have quite a bit of staff costs outside of the random moment cost pool. So the random moments are the workers who are working with residents and doing the work every day. The revenue we get is about 50% on both the administrative and the random moment side. So the estimated financial risk for the county is about $1.15 million per month once funding runs out through the shutdown. It would be a 2026 impact, as I mentioned, because you get paid basically a quarter behind. So the fourth quarter of this year gets paid in, say, February of 2026.
I have a question, Chair.
Go ahead.
Outside of processing new applications, and that would be waiting for the shutdown to stop so that they can be approved. Are we also supposed to be starting those new work requirements on November 1st? I guess the question I have is, prior to the shutdown, the new work requirements were supposed to be starting in November 1st. So I guess my question is, if we were to actually stop the work, right? Would not all of this be backlogging? That when the lights came back on and they say, yes, go forward, would we not just then have all of November's work to do along with whatever, and however long the government was shut down, would we not just have all of that backlogging? And we would still have to somehow get through all of that. I guess that's a question I have.
Defer to one of my colleagues. Sorry, go ahead.
Madam Chair, Commissioner, that is true. That's the correct analysis. And in terms of the work requirements, I'd also add, we didn't get a lot of direction from the feds on how to do that. And the state is still also haven't given explicit guidance on the work requirement parts. FAS internally has some processes and operations that they're planning. But you're right, it would be a backlog not only for business as usual, but as well as the onslaught of the work requirements effective in November.
So, and the reason why I bring that up is because I know we're gonna now get into some discussions of what our possible options are as far as how to use that time, but it's not as if the world stops and then we'll pick up again. These needs continue and the paperwork continues regardless of whether or not approvals and money is being distributed. Okay, I just wanted to clarify that. We're not getting any kind of pass to say, everybody take a pause. We still have the responsibility of this work mandated to us.
That's correct.
Okay.
Okay, I have Garrison, Cully, and Mary Jo.
Thank you,
In
Mr.
that
Chair. So
order.
I have two questions. One, just I know that you mentioned that a number of these employees, even while the shutdown is happening, will be able to do other work in some other areas. But I just wanted to get confirmation from the team here. Is there any risk that we would have to let go any FTEs that are focused on SNAP and WIC as if the shutdown continues to go on for, a few more weeks?
Commissioner, if you could wait till we get to the contingency planning, we can have some of those discussions. Is that okay? Can you go to
Yep.
your second question? Okay, thank you.
Yep, that's fine. And so my second comment/question, we have our upcoming AMC District 10 meeting. I had a chance to speak briefly with Commissioner Bingham, who's the chair of District 10, and of course, this will be a topic. This will be a topic that will be discussed. I'm just wondering, as we think of heading into that meeting, how much we want to leverage as a District 10, whatever our demands are, because it seems like there's still a lot that we need from the state, and how much do we want to do collaboratively as AMC District 10 to kind of put pressure on the state to help us figure a lot of this out as well. So that's not a question, but just a comment as we think about more broadly solutions and coalition building over the next, couple of weeks. We have that upcoming District 10 meeting that we should all probably start thinking through what our asks are there.
Commissioner Miller, you had
Kelly?
your hand up.
Yep.
Kelly?
Yep, thank you, Chair. This question's for you, Alex. If we are reimbursed for the work in the random moment studies from Q4 and we get that funding in Q1, is that reflected in our current year's budget? And is that how we budget going forward as well? So do we budget expecting the reimbursements from Q4 and Q1, or do we?
We do. Thank you, Mr. Chair, Commissioner. We do. We expect 4 payments in a year. So the 4 payments come in the year, but we're reimbursed retrospectively. So every year we get 4 payments. I just wanted you to understand that, because it's not like I would come to you this year and ask you for the money. It will impact our 2026 budget. But yeah.
Okay, I think that's where I was going with this question is our Q4 payment, is that in this year's budget, or is that expected in next year's budget?
It's expected in next year's budget.
Thank you.
Thank you.
Mary Jo?
Thanks, Mr. Chair. Thanks for all this. I'm going to follow up on some of my colleagues' questions, and thank you, Commissioner McMurtry, for bringing up District 10 meeting. And I'm hoping that will we be? I know things are changing all the time. Is it possible that we could maybe print out these slides, but if anything changes in the next week, it'd be good for us to go in there with information, the information we need. So maybe we could just have an update by that Monday morning before we all head into that District 10 meeting, because they're gonna. I don't know who's going to be presenting, Garrison, on that, but it would be good for us to sort of know our own situation when we go into that meeting. Yeah.
Commissioner, we can commit to a week from today, Friday afternoon, providing a written situational update for you as you go into the November report. Yeah, our third.
I can just hear my colleagues around the and asking how we're doing, and I'm just going to want to know the update. So thank you for that. And then, as we've talked about how we're communicating these things to our legislators, and I appreciate that, I'm hoping, and I can, as chair of the legislative committee, I feel like I should know this, or I can talk to Jen about it, but I hope we're keeping our congressional, delegates, Betty and Tina and Amy, they need to know, this is the stuff they want to know, like, how is this really impacting us? So I don't know. I mean, them, as much as our legislators, I want our congressional representatives to know this stuff, because they're in those conversations. So I don't know if we have a way that we can keep them really up to date. So we just need to work on that.
Board Chair, Commissioner Mary Jo, yes, we have been sending communications out, and I would even say we have staff in an AMC sponsored meeting right now that's taking place on
okay.
this, and there's 151 attendees in that space. The whole state is going through this, and there's some counties such as Meeker and Carver who are establishing and kind of on the same path as we are in terms of trying to keep their board up to date and do contingency planning. So we'll make sure that we give you more information for the AMC District 10 meeting as well, and just confirm that we are keeping our delegations and our congressional.
Keep our delegation. And if you can, NACO wants to know all this because they're lobbying on our behalf too at the national level, and I know they want to know how we're all doing. So I don't know if there's an email list that we're keeping people posted. If we could put NACO on that, our NACO government relations people, and AMC, as you said, we're in connection with AMC. And if you need those numbers, we can give those.
Thank you.
Thanks. Thanks, Mr. Chair.
Okay.
I'm done with my portion. I'm handing it off to Deputy County Manager Abdi, I believe.
Actually, I think it's going to me, Alex.
Oh, sorry.
Nope, it's all good. So we've talked about the first couple bullets here. What I want to highlight as we pick up the next steps with our 30-day overview plan. Sorry, I just got a little window that said I was highlighted that covered up what I was trying to say. Our intent here for the next 30 days is to cover costs temporarily with other county or grant funds that may require us going to our fund balance, which of course is a request that will need to come to the board ultimately for approval. We are continuing to explore options, as has been referenced, for reassigning staff to core county and non-disrupted work. We can tell you from a staff planning perspective that there is no language in our personnel rules or in any of our contracts that addresses funding interruptions or furloughs for funding interruptions. So if any staff reductions ultimately are recommended or would be needed, it would follow the layoff process that you're familiar with from our biennial budget process. It's the same process with the same level of disruption to individuals and to the organization. I also want to state that there is no advance notice requirement or timing notice requirement having to do with any potential layoffs. We can give people notice on day one that they will be laid off on the next day. So there's no 30-day or 60-day notice requirement of layoffs. That's just factual information I want you to have as context. As we consider what the time and the length of this disruption is going to be and how we manage the staff work underneath. I'll turn it over to the county manager then for the next steps.
Yeah, thank you, Johanna. So I like this slide because it just kind of summarizes everything in one spot for you in terms of timing and sort of strategy around the 30 days in terms of the estimated run rate, essentially. So for the two programs, as you heard, they're on slightly different timelines and they could change again. So the dates are a little bit, what they are. But basically, as you know, we are moving toward exhausting a funding source for the administrative staff. And as our CFO explained, there is, what those dollar amounts are, they're bolded here. In addition, as Commissioner Jevonsing said, and also the state has expressed to us, they would like us to keep doing the work because people are still needing to get through the process, and we've had backlogs and we know it's hard to play catch up and all of that as well. But I think rather than trying to come up with direction looking too far ahead, I think a 30-day contingency plan is probably what's realistic, as it's changing every day and the whole country and the whole state and everybody's feeling this pressure. We're hoping that we won't have to go much beyond the 30 days. What I'm suggesting here is that you guys have a solid understanding of what 30 days means for the budget. And that, with some direction, we will then be able to move forward and also, let's see, how do I say this? Do some additional planning to talk to you about what if we go into day 31 to day 60, and that might look a little different because we will have some more information and be able to do another granular layer of planning. One layer might be that some of the FAS staff in particular could be assigned to other programs that we could get random moment time study for. That seems like a big lift for a 30-day window because of the access and training that they would need. But if this went beyond 30 to 32, 35, 45 days, we want to get a plan for maybe the reasonability of that as a potential. So those are the kind of things that we could be working on in the background, should we go into a second round of 30 days. In addition, for your consideration, I've been in touch with other counties, especially in the metro. The metro actually is responsible for about 70% of the cases. So while it's really important that we continue to be good partners with AMC, I will appreciate what Commissioner McMurtry is saying around the impact of a District 10 should have in this conversation should be proportionate to your representation of who your residents that are feeling some of this pain, and the staffing too, as well as costs. They are all assessing their situations. I will say we are in a little bit of a unique situation in that Hennepin has a more robust fund balance for human services than we do. And then we are kind of a unique unicorn in that the rest of the other counties, in terms of their number of staff, start to go down very substantially. Does that make sense? So there's kind of the big Hennepin staffing, and they actually have a stronger fund balance for to address probably where they can pull from. And then it's us. And then there's kind of, Dakota that has maybe 20 people that work in some of these things, 30 people, but we have 253. So it's the scale starts to really drop as we move away from Hennepin and Ramsey on these programs. I do have some of those numbers that I can prepare. I'm trying to still get a couple more metro counties, but we're almost there. In addition, I think this is good to know. Some of the staff in smaller counties, they work differently. So their actual WIC staff might do a little bit of MFIP. They also might not be unionized. So there's a lot of different dynamics in how smaller counties might be structured. And in addition, 2 of our metro counties are currently in union negotiations with their AFSCME bargaining unit. So those are all the layers of things that the administrators have to sort of, and commissioners of your colleagues around the metro have to sort of balance as they work through sort of their contingency, if that makes sense. Let's see. And then I think in terms of the things that when I talked to our metro administrators that we thought the state could do to help us, certainly it would be funding. If the state could find a way to guarantee or ensure that we could continue to process and they would back support, even if the federal government didn't, I think that would bring some reassurances. We also are looking for more statewide approach and guidance. I want to just say kudos to our team. Like, they're working with 2 state agencies. Sometimes they're not communicating to the same level at the same rate. We need more statewide coordination, especially if this goes on longer and we see additional agencies and departments get into this beyond DCYF and MDH, that there could be even a 3rd or 4th agency. It is a mounting and very challenging thing for counties to figure out all the tangles, you know what I mean? And then lastly would be asking for more cross training. Like, we do want to be able to be planful about maybe shifting staff to some other eligibility programs, but we would need the state to speed up some things, open up access to things, be more pliable, nimble in this space. And that would really help us. And I think for the smaller counties, I will say that is really their goal. They would love to be able to reassign as many staff as possible to other programs, but that is a very daunting thing for each county to figure out on their own. So if there could be a coordinated effort from the state to support cross training, and do their part in making sure that that's possible, would be very huge. So those are considerations that we want to just make sure you're understanding as well. So I think at this point we are ready for questions, and so Jason, you can take down the slides. We can just talk, and the chair, if you want to, see who has questions, I'll turn it back over to you.
Okay, Lynn, let me ask you this, or whoever. What about, so as we move people to other jobs, so they could still, so we could keep them and they'll be functioning and getting in other areas that are programs that are not being effective. Where does bumping rights come into this? Because there could be a domino effect and a disruption if we're bumping folks that are working in one area and they bump somebody else in another area. Organizationally, that could be disruptive.
Yeah, I think you're talking about two very different things. There's reassignment of duties that's within someone's job description. So people who work on eligibility for SNAP could be reassigned to do healthcare eligibility, for example. And that would not be a changing of their job, if that makes sense. They would stay in that job. What you're asking, when you mentioned the bumping, that's what Joanna mentioned, is that, there are other scenarios that would follow through with like what we went through with our 26-27 budget process. There's no special process in the union contracts for this situation. All we have is the process that we've already spoken to you all about that involves bumping and those subsequent steps, if that makes sense. And hopefully, Kristen, Patience, you guys can nod and say that was pretty correct. Okay, good.
Okay, I think, did I have Mary Jo with her hand up?
Yep. Thank you, Mr. Chair. Yep, I do. Just to affirm a couple of things here, and we've already talked about letting our legislators know. I know they're sort of wanting to do something about all this. So what you just talked about, Ling, at the, was how we need to get a coordinated effort at the state. This is something our legislators can really highlight and put forward. So I hope, I'm assuming, but I'm hoping that's part of our messages to legislators, is that they can start talking to the department and say, listen, let's organize this in a statewide effort, or, let's get what we need to have happen at the state level for these benefits. So I just want to make sure that that message is getting to our legislators, because, they're like us. They want to know, what can we do about this? So that's a good step for them. And then also just to that last slide that we had, I know that Alex talked about this, and I just want to make sure I understand that 1.1 million in costs, that is not benefits to our residents. That is cost of our administration for that
those are personnel costs. Those are personnel costs.
For that one program, or for a number of programs. That's just, it's not split out. I mean, I know you said that seems like a lot, and it does, and I guess I've just never seen it disaggregated like that before. So that's a lot of administration, which I think no one's aware that that's how much it costs to administer some of those programs. But can you just, just affirm for me, yeah.
Commissioner, I would say two things to that. That's only 50% of the cost. We have over 260 FTEs that work to make sure that people can receive their monthly food benefits and support our residents. We have tens of thousands of residents that use this program every month. And so, and I was actually saying it seemed like a lot on the admin, not on the actual FTEs. I think I don't know, that's not mine to judge, but it seemed totally reasonable to me on the admin side, given the amount of people that we serve. My point on the admin was, because it's a program that gets funded through random moments, some of the staff that work on this, including supervisors, are not included in that.
Yeah.
So the cost per month is actually over $2 million. It's just that we have 50% levy attributed to the program, and 50% of it comes through the random moment revenue.
Wow.
Does that answer your question?
Yeah, no, thank you. It's helping me, because this is just an area that I just have not been aware of. And I think this is, as we're talking, I'm adding it to my list, but this is a really good area for us to do a hot topics conversation with our legislators about. I mean, just to sort of explain, because now it's just so prominently what people are talking about, that we can educate them on, okay, here's how this all happens. This is how this all works. So I'm just putting it out there, and I don't know that Jen she's on the AMC call, I bet, but I'm adding it to we're doing a list of hot topics for our legislators, and this would be a good one. So thank you. Thank you for that. And now Kelly, I see Kelly's hand up.
Thank you. I just have a couple questions. I know we have some community partners on this call, and I just want to ask a few questions. So when I did ask this at the board meeting when we were updated on it as well. Has there been any update on, we know if residents will have to reapply for their benefits once it is, I'm going to say like turned back on, or once it is refunded or a CR continuum resolution has been issued? Do we know a timeline of how quickly benefits will be reinstated or distributed once there is a bill signed and passed, and or how much we can get back to that work? So those are two, and then I have a few more. Do you want me to keep going, or do you want to take those in each?
I think, Commissioner, I'll just start and then I'll let Maria Andrews chime in. This is a difficult space for us because these are state programs, right? And we are kind of like, it's like a game of telephone at this point, and
Right.
we are at the bottom of the chain. And so we are cautious to not communicate inaccuracies or information that's not ours for determining. And so, and because it's changing so quickly, we don't want to give misinformation either. And yet, on the other hand, I understand that we are the face of this program, because when people have questions about the program, it is our service centers they go to, it's our employment counselors they call, it is our community partners that they reach out to, right? So we are in this really delicate space when there's not clear information to balance not providing misinformation or information that's not ours to share with accuracy, if that makes sense. So I don't know, Andrew and Maria, if you guys have more to add, but we're in a really hard spot here.
Board Chair, Commissioner, I'll add too, there's some unknowns at the federal level, like with the timeline after the shutdown. How quickly will OMB get funding to USDA? How quickly will USDA bring back all their staff from furlough that have been, the massive amount of staff from USDA on furlough to actually distribute funding to states? I think there's a multiple levels of uncertainty that it's hard to know exactly what that timeline is going to look like.
Okay, thank you for that. And then my next couple
Hold on
questions.
a minute, hold on a minute, Kelly. I see Nadar has his hand up.
Oh, okay.
Thank you, Chair Ortega. Commissioner Miller, I just wanted to follow up on the question you asked in regards to benefits being turned on, because that's something you mentioned in the past, and I was in a call with the DHS and DCYF this morning, and I brought that question up one more time just to get clarification. My understanding from what DCYF stated is that it depends on how long the shutdown continues to be. So if it's a very quick timeline of the shutdown, they're thinking that the mechanics of it will be very quick, where within 24 to 48 hours, like things could be turned back on. But if it's longer than that, then they're not sure, and they don't want to provide information. I have asked them to provide us information in writing so that we can kind of put that out there, that we don't say things that are not going to be accurate. So, but I brought it up because I heard you last time, and I know that's something to really think about, because we don't want to go back and redetermine all of those cases that have been paused. So the good news is it really depends on the timeline. So if this shutdown is within weeks, I don't think there's going to be any interruption. But if it's months, then that's probably a different story. So we would have to just figure that out. But I did raise the question, and I'm waiting for information to be sent to us in writing. And once we have something, we can probably provide a better communication to the community that's out there. But I don't think we can do that at this time because we don't have that in writing.
Okay, thank you. I also want to ask, I appreciate us focusing on internally, but I also just want to note that the importance of our partners in the network and the food network that we also have in Ramsey County. I do know we have a lot of $0 contracts with at least 13 food banks. So I'm just going to ask the question, is there a consideration at us as a county providing dollars to help alleviate some of the need that the uptick that the food shelves are going to be seeing? And if we also continue if this continues longer, is there something that we'll have to look at adjusting our budgets as we go and continuing and thinking of the next 2 years budget cycle?
Madam Chair, Commissioner, I am pleased to know that we have those agreements in place, and I think we need a little bit more time to figure out how we would be able to help out in this situation. I will say, we have folks in that other meeting that's happening right now with AMC and DCYF, and I believe the state agencies are also trying to put grants out into food shelves from a statewide perspective. More details will be coming out, but other partners in our system are also trying to respond who may have more bandwidth than us. So that's good news.
Thank you for that.
And I'll also add that, last week I was at the downtown, Ken I also was there too, but we were with the downtown residents. And we gave it a little update on our budget situation, and I also brought this there because it was timely. And they were like, we're ready to do a food shop, like what organizations do you guys know, like, or a food drive, like, I do think you guys have been in touch with a lot of people who've cared about everything happening. The Isaiah groups, the League of Women Voters, the community partners. This is a moment where there's a lot of community, hopefully, that can also fill in gaps here. And I hope you reach out to those networks and give that message, that of the people who reached out to you throughout our budget process, asking, how do we help alleviate some pressure to understand what's happening with your federal orders, your state budget, your federal budget. So there's an opportunity here for follow-ups, I think, with a lot of those interested organized coalitions. And I was impressed with just a set of residents. There was about 80 people at Union Depot. They were all residents of downtown. They were like, we need to mobilize ourselves. What should we be doing for our neighbors? And I was really impressed with that as their takeaway. Their takeaway was not what more should the county do? They actually were like, okay, what more could we do as a community? So I thought that was an interesting angle too.
Well, good. Let me just reinforce that. That's why at the last this past board meeting on Tuesday, I talked about, how private individuals are stepping up at the annual galas and raising money for food shelves, basically. But during the pandemic, I chaired the food security, and I got to tell you, at least, excuse me, my constituents, they stepped up, and people are willing to step up. So government won't be able to fund the food shelves. Ramsey County will not be able to sustain 2 or 3 months. This might not go away right away. So we need to mobilize the community to help out, and they will. They did it during the pandemic.
Mr. Chair, may I provide some thoughts too?
Go ahead.
I want to say first, thank the staff for being on top of this, trying to discuss with the state about where for both direction, but also where they actually really need to step up and help support. I appreciate County Manager Becker kind of identifying how Ramsey County is different in terms of both our staff size as well as the number of residents who rely on this service and support, that we actually really need to advocate and share with our state legislators about the impacts to Ramsey County. I also see that, the plan that we have before us about this 30-day contingency plan is, it's the best that we have available at this point in time with the information that we have. Moving forward, I would like a broader analysis about the budget impacts of what this may mean for our reserve. Because this is just one piece of what we will have to anticipate for costs, right? So I would like a more thorough analysis on the impact to our fund balance.
Chair?
Who's on mute? I think he was talking.
Okay. Okay, so yeah, I appreciate that. One of the things that I would love to be able to get just as a broader understanding of this program, and I know we won't have it right here in front of us, but as far as kind of a follow-up would be just to be able to have a basic, and I know we've seen this before, some basic demographics of who's receiving SNAP and WIC within Ramsey County and what those dollar benefits would be for an individual or a household. I think that there's that not everybody understands the dollar amounts that we're talking about and the impact on those families and what types of individuals and families are receiving these benefits. I think that would be really helpful. And then the other thing would be at an aggregate, you know, what is the total cost of SNAP and WIC to Ramsey County to operate? And I guess what I mean is we have that here, we have this monthly, but I guess to have that broken down to say, you know, monthly and annually, the responsibility of administering the processing of these of the applications and servicing to the individuals who are in these programs. What does that cost to Ramsey County? And then additionally separating out what dollars then flow because of helping individuals in Ramsey County access those services, what dollars from the federal government flow through the state to those individuals, meaning like the administrative cost to Ramsey County is X, and that facilitates the receiving of X dollars to individuals in Ramsey County. That would be really helpful to be able to see what is the impact to the individuals, what is the impact to Ramsey County, what is the dollars that are actually flowing through from other entities to our residents. So that's just for me to be able to understand that. The other piece of all of this, to piggyback onto Commissioner Zhang's really, I think, prescient point, is that today we're talking about WIC and SNAP because this is something that's directly going to be impacting in a very real and urgent way to a lot of individuals and families in Ramsey County very quickly, and to our broader ecosystem of food sustainability and our businesses and our groceries and all of the different impacts of this. But it is but one piece of the chaos that has been created through the shutdown and broader through the last year of federal changes and policies and cuts. So, I mean, I think about the other programs that we're dealing with that have had different cuts through public health, through our emergency planning, through all of those different things. And I guess for me, I even just think about the overhead costs of just dealing with this. You know, you've talked about a daily huddle. We've talked about overtime in October for processing as many people as we can, as fast as we can. There's the broader staff time as you all huddle and then ask your staff to do this contingency planning and then to do it again and then to do it again and then to do it again. And I guess for me, I think about, that's just the dollar amount of things that are being forced into all of this contingency planning, and people in community understand this because we all experienced this during COVID, right? How much time had to just be done and reinventing ourselves every 6 weeks. But then it also takes away from all of the other work that we're supposed to be doing, which is already really big in the county to begin with. And what's not being done because we have to do all of this. And so I say that just because I want to recognize the over and above that you all have been doing and continue to do, and the other big work that we're being tasked with that just doesn't get done because this is a fire we have to put out today. So that's just putting that into some context of what we're being asked to do. It's mind-blowing. So just thank you everybody for this. We'll continue these conversations, I'm sure.
Commissioner McMurtry, I think you got called on.
Okay. Thank you, Mr. Chair. Yep, I echo everything that my colleagues have said and really appreciate you all pulling all this together. My question is around just our communication strategy, and I know you kind of alluded to this, Ling, making sure that we are accurate in the information that we're putting out there, but also with the understanding that people who are going to be directly impacted by this are going to have a lot of questions and a lot of concerns. And so I want to make sure that on the community front that we are have a robust strategy around communications and conveying the latest as this shutdown continues, but also what's our communication strategy from an advocacy standpoint, a lobbying standpoint as a county, as we figure out how we want, what asks we have from the state, what asks we want to have to our federal partners. What does that also look like? So I guess it's two-pronged approach when it comes to communications, both on sharing out of information to those impacted, but also making sure that we are putting pressure and trying to get more solutions in place from our other partners as this continues to play out.
Commissioner Domingue responding. Oh, okay, thank you, Commissioner. I believe today, comms has already been working on a front-facing page that is gonna nuance some of that tension that I just kind of mentioned about, we're gonna have some links that go out to the state, for example, but we will talk a little bit about what we do know about Ramsey County. So there will be a page and we will share it with you. We also are working on talking points that also point to that page for our staff and for our community partners, because as we all know, like, even as neighbors, like someone might start asking about this program when you run into them at the grocery store, and we want to have, a source of truth, I guess, that is Ramsey County, like, center. So we are working on that. And then I don't know, Commissioner Jean, if you had a question, but I do have kind of the takeaways, Commissioner Ortega, so I'll just summarize those when you're ready for us to wrap up.
Yeah,
So.
I have Rena. Before Rena comes on, I just wanna emphasize or re-emphasize what Garrison just stated, and that is we gotta step up our communications during this time. Folks need to know what we're doing and why on both fronts, with the community and with our partners. So we need to put that on the agenda as a ongoing issue about how we're doing that and what we need to do if we're not. Rena,
Mr. Chair.
yes,
Oh, yeah.
I
Did you
have
call on
Rena
me?
has her hand up.
Oh, okay. May I go
And then,
next?
and then just jump in after that.
Okay, thank you.
Rena, you there? Okay, go ahead, my son.
Thank you, Mr. Chair. I also just want to name that, what we started out from the beginning is that this is a federal program. The county does not have money for benefits. The county only has money for administrative costs that we have been covering. So I want to pivot that too, because I know we have community partners. We need community to contact the USDA, the president, because these are intentional choices that they are making. Representative Liz Lee from the East Side posted and shared about how some of these funding shifts, and it's not about whether or not they still have enough money or not. It's about their deliberate choice not to fund this program. They have contingency funds available. They can continue to release benefits. They're choosing not to. So I would encourage and urge all of our community partners to speak up and reach out to our president of the United States to say, we in a world of abundance, people should not go hungry. So I would encourage for us to not look to just our local level here. We should actually actively be working and speaking up about this impact to our communities. I received, most of the commissioners here received a letter from Second Harvest Heartland just this morning about the stress that it has on the food shelves, that right now the food shelves cannot absorb anymore. And I really understand that, and we need to speak up and say that. We need to be calling on the federal government to step into the space. And in addition to that, to our community and private partners, that this is the time to step up and to donate money to food shelves in this time of need.
All right, can you hear me?
Yes.
Wait, let's
Go ahead,
see here.
Rena.
So I just want to echo exactly what I just heard Commissioner Zone talking about. This is a horrific moment in time. And, people, families, children, elders, all going to be really suffering because of the impact of what's happening at the federal level. This is a state program that comes down to the county for us to implement. And this is the moment in time where we need a really coordinated process with our community partners. All in from everyone. This is not something that the county can take on, because at the end of the day, it's going to hit the residents that we're trying to help. And so part of that communication process is, this is not ours to carry. It is the federal government who has chosen not to put some safeguards around this program that is about women and children and babies. And so as we think about that strategic communication piece, and coming together with our partners at the state level, with our community partners in the philanthropic community, in the private sector, we need to have a message that does not allow it to become something that we are not doing and can't do, don't want to do, but a federal government who has set the president around what they're not going to do and who they're not going to support and or save. And so I just want to thank the staff. I want to thank the county manager and everyone for bringing us in today to talk about this very, very important issue, and really began to look at how we are going to become the messenger of something that is really, really important at this moment in time. Yeah, because this is not the burden of the county. It's not because of anything that we have put in place. We are just the implementation of a program that needs the funding from the federal government that comes down to our state for the county to implement. So thank you all for all your good work and your leadership and the time that you have taken to just really update us so that as county commissioners, we can have the words and the language and also be a part of the solution in bringing our community partners and others together around this issue and this impact, which is one of many to come. Thank you.
Thank you, Davina. Let's see, who else do I have? Okay, go ahead, Lynn.
Yeah, so let me just summarize kind of where we're at. I hear affirmation that our 30-day strategy is in alignment with the board in general. You understand our run rate, and we are going to come back with a next round of analysis, likely before Thanksgiving. And I heard things like you need more detail around some of the budget pieces around, I have the details written down. We want to show maybe who's being impacted. We want to provide, and then more updates on what we know from the state at that point. So kind of, I'm hearing that the 30-day sort of cycle, meeting with you guys 2.5 or 3 weeks in is going to work here. So if that doesn't work for you, please let me know. We're going to take this down to another level of detail and granularity for you on the budget side, so you can better understand. I hear a lot about communications, external partners, residents, also the advocacy. You'll get a situational report a week from today, maybe even before that. I'm going to meet with the Metro administrators today. I think I need to come up and work closely with Maria and the government relations team as we move into AMC. Like, this isn't a Ramsey County platform. It is some of the things we need to ask for, it needs to come from the Metro at least, if not statewide. So let me try to figure out what part of information you need to be able to talk about our unique Ramsey County situation, but what we need as a collective body through something like a District 10 or an AMC to sort of advocate on our behalf. So I think if you hear differently or think differently, let me know. And then I think with that, our team will continue to work. We will continue to send you urgent things that are changing on a daily basis if there are something that's pressing. Otherwise, we will schedule another time to talk to you within the last half of November here, should this continue. Does that sound reasonable? Do you feel comfortable? Yeah.
Yeah, Ling, what I want you to do is look at the calendar.
Okay.
And see where we could bump non-essential issues of, workshops with we don't need an update on certain things when we could be talking about this. I think the board needs to have more conversation and discussion, just so when it comes to, and if we have to make critical decisions, they got a good basis of knowledge and a better feel for how to take those if we have to. I mean, if this goes on 2 or 3 months, God forbid, we got to be in a operational mode. So I just want you to keep that in mind there. We just don't need another check-in at the end of the month to say, the world fell apart. I like to have more frequent ways of getting updated.
Mr. Chair, if I may.
Go ahead.
I agree with that. I think this moment in time calls for us to be nimble and to add this to our calendar if we need to. It's always easier to place holds on calendars than trying to scramble and figure it out. So I would be supportive of more regular check-ins. Another request that I have is just I think a message, Mr. Chair, from our board calling on residents, our philanthropic community, our community partners to step up to message and contact both about the federal impacts to Ramsey County residents and also to call for help for our donations to our shelters. I don't know if you would be amenable to that or be open to that, but I think our board as a collective can also put a position together that may be shared versus, coming from just Ramsey County.
I totally agree. That's why we need to enhance the communications.
Yeah, I agree.
Yeah, we really need to do that. We all could do it individually, but I have started doing that in my district when I'm talking to groups. I'm telling them, like the pandemic, I expect folks to step up. I know that in my district, the community stepped up big time with the homeless and putting food in contributing to food shelves. You ask them, you'd be surprised the results you get. So we got to do a better effort to get community involved, the broader community.
Chair, may I also add, and I'm sure this is already being done, but just to reiterate, that as we go through these very sensitive times and it's evolving, that we also be mindful of our labor groups and our employee groups, and to make sure staff who are impacted by these cuts have clear communication so that they understand where we're at too, as much as we can. I mean, when I say as much as we can is because this is evolving hour by hour, but that we also are very mindful of the stress this must be putting them and their families in as well.
That's going to be all part. That's why we really need to enhance communications. That's another constituent group that we gotta continue the conversation on a weekly basis, really. Anything else?
I was just gonna respond to that. I can go ahead, I do meet regularly with many of the union leaders. I think this is mostly the Ask Me group. I don't know if it, so I will work with patients and we will, bring this onto an agenda item so that they understand that, kind of the situation as well. So, if the board is open to that.
Well, I'm
So
sure
otherwise,
it's going to be on all fronts. We just got to be prepared, Lynn.
Yeah.
You can meet with them all you want. It isn't going to stop them from calling us.
I agree. I get it. Yeah.
So we got to do a broad. It has to be a coordinated effort across the board.
Okay, thank you. I think we are wrapped up from the staff side. Chair.
Okay, thank you, everybody. Have a good weekend.
Thanks, everybody. Thanks,
everyone.
Thanks, everybody.
Oh, yeah.